Marek Jantos from Australia, Anatomy of Success. Marek, floor is yours.
It's wonderful to be here with you today. I was looking forward to coming back to beautiful Poland and coming back to the city of Lublin, which I really enjoy because of the wonderful people that I have met here. It's a lovely city, and I'm glad to be here with you today. I've had the opportunity of collaborating in some research with faculty from this university, and I must say that this is probably my first opportunity to publicly express my gratitude for the honorary position that was granted to me at this university, so I thank you very, very much for that. Some time ago, my father, who is now 83 years of age, shared with me a treasure of Polish poetry. It was a book that he took with him when we left Poland in 1963. And back in those days, it was not permissible to take any literature out of Poland, and so the book had to be partially destroyed by having the first pages torn out of it. So I can't even give you the title of the book, but the most wonderful thing about it is that it expresses sentiments which really resonate with me on a day like today. It's a poem by a very renowned Polish poet, Adam Mickiewicz, and the words are on the screen for you to enjoy. While presenting this lecture today, I feel very humbled to be presenting this before an audience of lecturers and students, because I'm very mindful of the fact that there are probably many people in this audience who have far better credentials than I do and are much more qualified to speak on the anatomy of success than I am. But anyway, I'm feeling very honored, and I want to acknowledge the faculty of this department that are here, and in particular, I want to acknowledge its chairman, Professor Maciejewski. Thank you again for inviting me for this special occasion. And to you, dear students, who make up the larger proportion of this audience today, I want to congratulate you on the very fact that you are here. It's an acknowledgement of already an initial success in life in being accepted into such a fine university as the Medical University of Lublin. I want to share with you some thoughts and some reflections, and much of what I have prepared has been prepared with you in mind. In the field of medicine, as in other areas, we oftentimes mark progress by mapping. Mapping the body through anatomy, mapping the brain, mapping the nervous system, mapping the human genome. And, as with cartography, whoever maps it sometimes seems to own it. And so we tend to name parts of the body after the people who identified those parts. We tend to name certain disorders and pathologies by names of individuals who identified them. But generally speaking, I would say the anatomy of success is much more than just identifying parts, achieving grades, completing classes, and so forth. The anatomy of success exemplifies something that is much more holistic, something that is much more meaningful, and I would like to suggest to you that true success is exemplified not only in the way we look at things and think of things, but in the way that we live. And so I have organized my presentation today into 3 sections, reflecting on the meaning of success, considering some aspects of anatomy that might be of interest to you, and then thirdly, sharing with you a little bit of my own personal journey. Now, I have to admit that in reflecting on this topic, I was somewhat challenged, knowing that I was coming from a very, very different culture, not only one that is so far removed geographically from Poland, but one that possibly shares different values and a different lifestyle. And so I was challenged in knowing how I could establish a certain common ground in focusing on the theme of the anatomy of success. But I would like to suggest it would be easy if we were to take it from a classical anatomical perspective, because it's there as we reflect on the human body, as we reflect on its complexities, on the complexity of the brain and the complexity of the mind, that we can stand hand in hand in absolute admiration and awe. There is a tendency, though, in classical anatomy to tend to see the body as consisting of many different parts, different regions, as if they were unrelated. And I hope that we never lose view of the fact that our body is a very holistic perspective. Otherwise, we might be inclined to take the view, as many technology-oriented people do, of seeing it as consisting of disposable body parts. And so it's interesting when I look at the American techno-prophet, whose name might be familiar to you, Raymond Kurzweil. His prediction is that the body and the brain is nothing more than a complicated, sophisticated computer. And that progressively over time, these computers, worth only $1,000, will be able to compete with the human brain. He actually predicted that by the year 2050, a $1,000 computer will match the capacity of all human brains in the world. He also predicted that we'll multiply our intelligence by billion-folds by linking wirelessly from our own neocortex to a synthetic neocortex in the cloud. Now, Kurzweil has distinguished himself in this area, particularly working for Google and so forth, and has made millions of dollars out of artificial intelligence. But not for a moment do I share his perspectives on the human body and human anatomy and the human brain. I don't think a computer will ever be able to compute and compare with our fantastic and complex brains. It'll always end up shuffling symbols. It'll never gain consciousness, as Kurzweil has suggested on several occasions. It'll never be able to appreciate spiritual values, as he has suggested in one of his books, The Age of Spiritual Machines. Much of what is presented as futuristic vision is nothing more than science fiction and bad philosophy. Man in his wisdom does not possess the capacity to produce life in the smallest object in nature, not to mention producing consciousness and sentience, which is so unique to our human existence and our human characteristics. And just as our bodies and our minds are much more than the sum of the individual parts, I want to put to you today that the anatomy of success is more than just learning, more than grades, and more than certificates of achievement or prestige that might be associated with a given profession. And so today, as we reflect on the anatomy of success, I would like to draw a little bit from the field of philosophy as well as theology, and also link it to our study of anatomy. But most of all, I want to bring in a personal component there, which I think we should be all encouraged to do, and to look at the lesson book of our own life stories. And as we search through the pages of life and remember the people that we loved, the things that we learnt, and as we experience on that process of re-examining where we are at, we are engaging what Frederick Buechner in his Harvard lectures identified as a sacred journey. Let's reflect specifically on the anatomy of success. Today I want to suggest to you that success is a journey. It's not a destination. I believe that journey, to a very large extent, is inspired by three vital elements. Conviction, which I want to refer to as faith. Optimism, which I will label as hope. And passion, which I will refer to as love. Coming from the Australian culture, one that prides itself in being a secular culture, I am intentionally borrowing terminology from theology so as to emphasize not only the importance but the very noble, self-sacrificing nature of medical work and of your professional calling. I urge you not to misunderstand. In borrowing terms from theology, I am not necessarily linking them to religion. The two I see as being quite different. But let me first of all reflect a little bit more on the topic of inspiration. And there, I want to quote from someone who will be very well known to you, a very distinguished Polish poet, Wisława Szymborska. If you have ever had the chance of reading her acceptance speech when she was awarded the Nobel Prize, it really reflects so much on the theme of what it is that I want to share with you today. Allow me to quote briefly from one of the paragraphs that she wrote there. There is, there has been, there will always be a certain group of people whom inspiration visits. It's made up of all those who've consciously chosen their calling and do their job with love and with imagination. It may include doctors, teachers, gardeners. I could list 100 more professions. Their work becomes one continuous adventure as long as they manage to keep discovering new challenges in it. Difficulties and setbacks never quench their curiosity. It's a lovely statement. But when you read the later paragraphs that follow on from that particular paragraph, it's a little bit more disturbing because it's there that Szymborska states this: there aren't many such people. Most of the earth's inhabitants work to get by. They work because they have to. They didn't pick this or that kind of job out of passion. The circumstances of their lives did the choosing for them. Loveless work, boring work, work valued only because others haven't got as that much. This is one of the hardest human miseries. Now, students, I would love to think that none of you fall into that second category. And even though there aren't too many such people whom inspiration visits, I sure hope that that is the case with you. I hope that is your calling in life. Because without a higher inspiration and genuine sense of the sacredness of life, perhaps even as it is reflected in the Hippocratic Oath, the practice of medicine and life in general can become what one Harvard scholar has called a very violent enterprise. Listen to what he has to say in a book that is cited. He states, "A successful life has become a violent enterprise in which we endanger our health by pushing our bodies beyond its limits. We neglect our family and social connections because we have no time for them when they need our own company. We fail our communities because our sole interest is in protecting what we have. We neglect our spirit because we are too preoccupied to listen to the quiet voices that seek to nourish and refresh us." And it's there that I want to come to looking at the three elements of success that I have already mentioned in introduction. The first one of these is faith. Faith is defined as a firm belief in something for which there is no proof. I emphasize that because faith is not based on empirical evidence. And yet, it is one of the essential elements in the path of success. It literally means that you are willing to take the first step towards something that you have not had the opportunity to experience before. Faith is something that is calling you forward to a goal that lies ahead. You haven't been there yet. You are taking the very first steps in that direction.
And here are attributes of successful people. Successful people believe that life has meaning and that each one of us has a purpose. Our conscious minds are characterized by the fact that we always seek to make meaning of the things that we learn, of the things that we experience. And so Viktor Frankl, the well-known Austrian psychiatrist, refers to this as the will of meaning. We need to believe that there is meaning and that there is purpose, and we need to move forward in that faith. This is very well reflected in the words of Brian Stacy, who said this in the book Success Principles. I believe that each one of us is born with a purpose. Identifying, acknowledging, and honoring this purpose is perhaps the most important action that successful people take. They take time to understand what they are here to do, and then they pursue that with passion and with enthusiasm. And that is exactly what we want to emphasize when we look at that pathway that you have chosen to go on. If you believe that you have been called to serve humanity, and that caring for people and loving them is your calling, then you have identified the highest calling ever given to mankind. With such a belief, you will go forward convinced that your studies are important and that the work you hope to do is significant. If that faith is strong and well-grounded, it will lead to success. But let me warn you, and I'm sure you have seen this in history, what will challenge your faith most is witnessing man's inhumanity to man. But I hope that your faith will be strong enough whenever it's tested to still progress and move forward. The next ingredient that I have mentioned to you is the ingredient of hope. Hope is defined as a feeling of expectation, a desire for a particular thing to happen. Hope is very much linked with optimism. Successful people always live in hope. You have been anticipating and continue to anticipate the conclusion of your studies, the fulfillment of your dreams and aspirations, and that is so typical of successful people. As you live, work, and study, you are hoping for positive outcomes in the near future. Hope and faith are both linked because both are based on something that you have not experienced, something that you have not seen as yet. Let me illustrate briefly, because it was only 2 months ago that my nephew, a very healthy young person who had his eyes fixed on a career in journalism and international relations, went out for a mountain bike ride on a Sunday afternoon. And at one point in time, as they were traveling together with his colleague, he came off the bike and landed head first. Instantly, he knew that there was something wrong. He tested for movement and could feel his toes move and his fingers move, but he knew that there was something wrong. And over a little moment of time, as his friends gathered around and wanted to pick him up, move him to the car, he was concerned that it was more serious than that. But eventually, a car was brought close and he was transferred to the vehicle. Fortunately, one of his friends had the wisdom to suggest that he must go into hospital for a checkup, which he did. And much to everybody's surprise, he had a horizontal fracture of the spine, which you can see on the film just there on the right-hand side. And it's amazing that only a hairline movement could have left him paralyzed. For several days, he was examined. He had various tests and MRI scans and so forth, and then it became evident that his only hope of ever walking in life again was by having surgery. As a young man who had his eyes fixed on a career, he knew this was the only step available for him. And it was after 4 days of laying flat on his back, unable to move, that a neurosurgeon from Sydney, attended his bedside and explained to him exactly what would be done. On a Thursday afternoon, 4 days later, he was transferred from the bed onto an operating table, a very, very critical move that could have still left him paralyzed. And after 2 metal rods and a plate were secured in position in his spine, the very next day he was made to stand. Doctors were predicting that it would take 6 months for him to recover before he could even contemplate going back to work. Within 4 days, he sent me a picture of himself getting discharged out of hospital. Every day, he would walk 4 kilometers, 5 kilometers a day. Instead of 6 months of rehabilitation, he was back at work within 4 weeks. Can you see the difference that hope can make? If your eyes are fixed on a particular goal and you are motivated, that will propel you forward to where you want to be. Ambitious, driven, motivated, living in hope. Just last week, he sat through the Senate Estimates Committee attending to his work. What happens when that hope fades? Life's meaning begins to fade. And if you have ever read the work of Viktor Frankl and his portrayal of what happens in that state of helplessness, you'll realize that oftentimes when hope dies, so does our heart, and so does our life. There are some things in life that are easily overcome. Others can break us. But if your faith is strong, if your hope is fixed, that will pave the way for your success. The next point that I want to focus on is the point of love. Please don't ask me to define what love is. That's a little bit more complex, a little bit difficult, but in the professional context, I would like to suggest to you that love is something that is impersonal. It is quite different to interpersonal love. It's impersonal because you fall in love with a career. You fall in love with a calling that you have in life. And if it is to serve humanity, it's a form of altruistic love. And so there, if we look in the context of your work at the meaning of love, and particularly at the meaning of passion, I want to remind you of the origins, the roots of the word passion. They come from the Latin word of pati, meaning to suffer. It's the same root origin of the word patient, the individual who suffers. And what it connotes is that even when you pursue a very noble mission, when you pursue your goals and your ambitions in life, the experience can oftentimes be painful. But it's there that we need to be determined and stay the course. On many occasions, I have had the opportunity of traveling in Africa, in Australia, in Nepal, and there visiting some of the hospitals, I have met people that have inspired me because of their passion and their love for work. This was particularly the case when I was visiting Nepal recently and visited a leper hospital. There are still leper colonies, there are still leper hospitals in parts of the world. And it's there that I met medical students from my very own city of Adelaide who were there doing their placements because of a particular passion that they shared. I really enjoy this saying, you don't have to change the world to be important. There are so many little things that we can do in life, but if they are linked to our desire to help, to serve, and if we are passionate about it, it will indeed make a very, very big difference. You don't have to be wealthy, you don't have to be well off to make a very significant impact on people. And I love this quote from Steve Jobs, who says, your work is going to fill a large part of your life, and the only way to be truly satisfied is to do what you believe is great work. And the only way to do great work is to love what you do. If you haven't found it yet, keep looking. Don't settle. As with all matters of the heart, you'll know when you find it. So whether you are of humble stock and materially poor, if your life is a life where you sense a calling and a sense of purpose, you will be a blessing to humanity. So in summary, what I want to suggest to you today, that faith, meaning, purpose, hope, and passion, these are the essential ingredients in the anatomy of success. And if you believe so, then the world will be a better place because you have been here. Others will benefit from your life, and your own life will be enriched and changed. And this, I feel, is the true measure of success. I want to focus with you now for a little bit on anatomy, and somewhat use the example of someone that I have come to know recently as one who typifies the very points that we have raised in terms of the anatomy of success. I have worked in the chronic pain area for over 25 years. And years ago, as I was doing the ward rounds of the Canberra Hospital on the oncology ward, there were specialists there from the sexual medicine unit visiting with me by the bedside of some of the HIV/AIDS patients. And at one point, they said, "Is there any chance that you would consider joining our team to help us develop protocols for the management of chronic urogenital pain?" I didn't know what I was committing myself to. I didn't even realize that this would be my line of work for the next 20 to 25 years. In the line of that work, my paths have crossed with many wonderful people through conferences, through publications, through presentations, and hence I'm here today. But recently I enjoyed meeting Dr. Carla Stecco. Among other things, she is the Professor of Human Anatomy and Movement at Padua University. But her life has focused almost solely on the study of that little-known body organ that we refer to as the fascia. And like the beliefs and the actions in the anatomy of success, this white packing material that holds our body together actually also holds the secrets to a very successfully functioning human body. And with the permission of Dr. Stecco, I will use some illustrations taken from her most recent book, The Functional Atlas of Human Facial System, and I will share a little bit of her life story to illustrate what we have been discussing. Her interest in anatomy started very early in life, when her father, Dr. Luigi Stecco, proved to be her best mentor, and at a very stage of her life introduced her to the dissection of animals. And this generated a great deal of interest in anatomy, which ultimately became the passion of her life. In dedicating her book to her father and family, she writes this very lovely tribute to her mentor. "To my father for inspiring me to look beyond classical anatomy and for an enduring fascination with the fascial system." Her work has been highly acclaimed internationally. And in the introduction to her book, there are these interesting words written by Professor De Caro, the president of the Italian College of Anatomists, and he states, "Over the years I have appreciated firsthand her devotion to research and her way of thinking outside of the bounds of convention. She was always strongly convinced of the truth of her findings, even when they did not conform to current orthodoxy. The success of her ideas in recent years has been demonstrated through her work and through her conclusions." In a paper that Dr. Stecco wrote, she identified the human fascia as the forgotten structure in the study of anatomy. This poorly understood organ system links the whole structure and function of the body from head to toe. And really, to appreciate the anatomy of the human body, its continuity, its pathologies, it's absolutely essential that we have a good understanding of the human fascia. In introducing the human fascia, first of all, I want to suggest that it's a little bit like a bodysuit, consisting of very fibrous connective tissue that covers from head to toe. The Latin word for fascia actually means band and refers to the connective fibers, primarily collagen, that form sheets of bands of tissue just beneath the skin and deeper in the body. The fascia, in total, occupies a far greater area than the skin of our body. And all of the body's structures, be they muscles, be they bones and joints, are protected, embedded, or, as some people would say, are invested in this three-dimensional matrix of soft connective tissue. The fascia, in many ways, acts as a bandage, as a packing substance of the body, while at the same time providing the conduit through which neurovascular bundles can easily penetrate. It attaches, stabilizes, encloses, lubricates both muscles, ligaments, tendons, internal organs, blood vessels, nerves, and other soft structures. The net effect of the fascia is that it holds our whole body together in one integral functional system. Now, there is growing clinical and research evidence to suggest that the fascia plays a very significant role in the etiology of pain, in blood flow, in dissipation of tensional forces between different muscles, bones, and joints, the interaction among limb muscles, movement, perception, peripheral coordination of agonist, antagonist muscles. But most of all, what intrigues me in the study of fascia is this very holistic approach which shows that the fascia is very closely linked to our sense of consciousness and our sense of well-being. These different complex functions of the fascia arise from the very unique mechanical properties of the fascia and its very rich innovation. Let's have a look briefly at the structure of the fascia. The fascia consists of four primary layers: the superficial layer, the deeper layer, the meningeal layer, as well as the visceral layer. The thickness and strength is determined very much by the forces that it resists. Let's for a moment focus on at least two of those layers, the superficial and the deep layer. The superficial fascia, which sometimes is referred to as the panniculus fascia, forms the external sleeve of the body. It, in appearance, looks like a honeycomb, dynamic, able to stretch, while at the same time resisting multidimensional mechanical loads. It consists of low-density collagen fibers and is packed with elastin, which gives it a high degree of flexibility. And within fascia, we see these little ligaments that attach the skin to the superficial fascia and that also attach the superficial fascia to deeper fascia and bone tissue. We find the superficial fascia over the face, neck, breastbone, torso, genitals, and also the lower limbs. It surrounds organs, glands, and nerves and blood vessels, as has already been mentioned, and also fills unoccupied space. It serves as a storage medium for fat and water and as a passageway for lymph, nerve, and blood vessels. Provides protection through providing padding to cushion and insulate the body. There are some muscle fibers in the superficial fascia in the face, neck, areolar areas and genital areas, and these regulate the amount of tension that the fascia holds and transmits. When muscles contract, the elasticity of the fascia is reduced because it tends to thicken by about 25-26%. As muscles contract, though, they do facilitate drainage of the lymphatics and also of the veins, which lay immediately below its layer. Most of the cells present in this subcutaneous tissue then produce heparin, serotonin, and histamine, and also act on the small blood vessels, affecting their permeability and mediate inflammation. When we look at the subcutaneous vessels of the fascia, it's interesting to see how these cross different planes of the fascia, reaching to the top of the skin, some of them crossing the fascia in perpendicular fashion, others tend to follow in a longitudinal fashion before surfacing. And it's interesting to see how the tension of the fascia can reduce blood flow to the superficial areas to the point where it can even choke some of these arteries, causing the skin color to change dramatically and even bring on chronic ischemia. Ischemia subsequently results in the production of more fibrotic tissue, which then starts off a fairly vicious cycle, obstructing and reducing perfusion. Let's have a look briefly at the deep fascia. The deep fascia, or investing fascia, or axial fascia as it's sometimes known, is the second layer of fascia which forms sheaves which protect and envelop nerves as well as blood vessels. The deeper fascia consists of higher density of collagen, giving the deeper fascia its strength and its integrity. But it is very richly innervated with many sensory receptors for pain perception, which we call nociceptors, receptors for movement, which we call proprioceptors, receptors for pressure and vibration, which we call mechanoreceptors, and chemical receptors known as chemoreceptors, temperature receptors known as thermoreceptors. Deep fascia is very responsive to emotional stresses, and so you can sometimes observe rapid fascial constriction during sympathetic activation and slow or rapid relaxation depending on the feedback from self-regulatory structures and reflexes. Muscle tissue within the fascia generates the tension that is sensed throughout the system. And for many years, as we have looked at potential mechanism for chronic pain, we knew that oftentimes chronic pain conditions were characterized by muscle tension. But that still didn't explain how that caused bladder pain, urogenital pain, and abdominal pain. And of course, it's interesting to note now, as the muscles invested in the fascia contract, that begins to exert sufficient tension for that tension to begin to not only pose some restrictions, but to potentially irritate and bring on inflammatory states that sometimes we refer to as non-specific inflammatory conditions. And so it's very interesting to note some of the causes of fascial restrictions, and I've listed some of them there. One of them is emotional stress, and it's interesting to also comment on the fact that much of this fascia is characterized by smooth muscle tissue, which is highly responsive to sympathetic innervation. When muscles bulk up, it leads to an energy crisis where the bulking of the muscle exerts sufficient compression on fascia and the blood vessels in it as to reduce blood perfusion very significantly. Oftentimes we say a 20% contraction of muscle tissue results in an 80% reduction in blood flow to that area. But it does raise changes, myofascial changes, which ultimately lead to myofascial pain, trigger point pain, on account of the energy crisis that exists. And if you look at these samples of fascia, you can see how the spaces in the fascia on the left-hand side are much, much reduced when compared to the spacing in the fascial tissue on the right side. One is typical of chronic pain conditions, the other of an asymptomatic state. And of course, even if we were to look, and I don't think I'll be able to activate this ultrasound video, you could see how the movement in the fascia is so different in a person with chronic pain to that of a person who is asymptomatic. One is much more rigid, the other is much, much more relaxed and movable. Oh, there it is. It actually works. There you go. Can you see the asymptomatic and the symptomatic above? Chronic pain and no chronic pain down below. Lower back pain. It has been suggested that the density of receptors in the thoracolumbar fascia is such that much of the pain that we experience, non-specific pain in lower back, actually emanates from the fascia and not so much from the lower back muscles. And fascia, as a continuous organ, has this unique characteristic that tension in one area is very easily related to tension in the other areas, and we sometimes are very mindful of the fact that back tension, abdominal tension, is directly linked to pelvic tension. Tension in the muscles, lower limbs, also linked to tensions in the pelvic area. I want to progress from there, though, to look at fascia as an organ of communication. And this is where some of the most interesting and fascinating work has been done. Sir Charles Sherrington, a Nobel Prize winner, identified in 1906 the different functions of receptors in our body, classifying them as being exteroception, proprioception, and interoception. And I'd like to briefly discuss the first two, but focus a little bit more on the last one. Exteroception refers to our ability to detect changes in the external environment, external to the body. So exteroceptors are the organs that provide information that originates from outside. So it's our eyes, it's our ears, it's our mouth, it's our skin. And it's these that provide us with the information that we need to be able to interpret the surrounding environment. It's interesting to note that it could be these exteroceptors are also sensitive to atmospheric changes of pressure, and that this might be related to pain. But the brain integrates information from these different receptors in a very meaningful way, and this information is processed in ways that is very helpful to us. If we look at proprioception, it's our ability to sense position, location, orientation, and movement of body parts. This information is derived primarily from fascia in the muscles, in the tendons, and in the joints. The brain integrates this information together with proprioception from vestibular systems, and overall this helps us to maintain proper body position, movement, and experience changes. In humans, this is quite a distinct characteristic, and it also gives rise to conscious proprioception and unconscious proprioception. But what I find most significant is looking at the role of the fascia in interoception. This is our ability to sense changes within our body. This is our ability to know how we feel and our awareness of hunger, of temperature changes, of sensual touch, of changes in organs, muscles. And these interoceptors are very directly linked to our behaviors because they tend to motivate us to engage in certain behaviors. So if I feel hungry, I will eat. If I feel tired, I will choose to rest. If I feel unwell, I might choose to go and see a doctor. So these interoceptors have a very strong motivational component. It's interesting to note that a number of these interoceptors are found in the muscle tissue, and that the ratio of interoceptors to proprioceptors is a ratio of 7:1. It's interesting to note that 80% of these free nerve endings actually end in muscle tissue, and 90% of these nerve endings are actually slow-conducting C fiber neurons. What's most interesting is that these neurons are differently organized in terms of relaying the information to the brain to those of the proprioceptors. So most of the interoceptors tend to relay their information through the spinothalamic channels to the thalamus and then continue on to the insular cortex. This is quite different to proprioceptors that primarily find their way to the sensory motor cortex. And Olofsson and others found and published in 2008 a finding which is fascinating because when you stimulate these C fiber neurons, they result in activation of the insular cortex, but not the somatosensory cortex. Now, when we also consider the very rich innovation of the whole enteric nervous system and of the gut, then we realize that the 100 millions of neurons located in the connective tissue there, that most of these are also interoceptors. The interoceptive receptors are very responsive to social touch, mediate emotional and hormonal responses to caressing, to touching, as in touching of the skin between individuals, and this has a very profound implication for human health and for human well-being. We know from some of the experiments by Harlow and others that young babies who are not provided with tactile contact fail to thrive. Adults, not only babies, adults respond also with increased sense of well-being when they are touched. Touch is an important part of social behavior and of our intimate behavior, and this is mediated very much through the interoceptive process. Human emotions are closely linked to interoceptive sensations. If I'm hungry, I tend to be angry. If I'm satiated, if I'm feeling well, I tend to be happy. And so, even with emotional disorders such as anxiety, depression, and irritable bowel syndrome symptoms, these are all labeled as interoceptive disorders, mediated by these slow C-fiber neurons. And it turns out that this white packing stuff that oftentimes just gets in the way of surgery and in the way of cadaver dissection, that this tissue that in the past has been so meaningless turns out to be absolutely central and essential to the successful functioning of our human body. And it's there that the study of fascia, human fascia, brings definite interest and captivation to someone like myself who has been working on chronic pain conditions and studying the mechanisms of chronic pain. And I have done that for 25 years. I have seen thousands of patients, and admittedly, there is still so much more to learn. And as long as you can see the potential for learning new things and developing new ideas, work continues to fascinate, continues to motivate. But at this point in time, students, as our time has passed on, I want to move on to a little bit of a personal section, and I hope you don't mind if I share just a little bit of nostalgia with you to conclude today's lecture. As a young boy growing up in the 50s and 60s, I lived in the beautiful city of Krakow. And I oftentimes remember going on holidays from Krakow to Wajnszut in an old steam train that would pull out of the Krakow Central Station, and I was heading off for a good country holiday. I would remain glued to the train window, and I would watch the world speed by as the ambers and the smoke would drift by, and hours would pass until the train eventually would ease into Wajnszut. And there I would immediately look for my grandfather, who would oftentimes wait for us in a horse-drawn carriage, and he would pull up by the side of the train to unload our luggage, reload, and to take us home. That journey home was always filled with anticipation. I would watch grandfather's horse take us home without any direction because he knew his way home. And then when we arrived home, I would await the welcome and the greetings of the family, particularly of grandmother. And after those initial greetings, I would always run inside the house and begin to explore every nook and cranny, something that I would do every time I would visit. And it's there that I would enjoy the smells of the attic, smells of the basement, and ultimately end up sitting at the kitchen table where I would observe the grand clock ticking away and oftentimes would play with its chains adjusting and winding the clock up. But ultimately came meal time, and I looked forward to those freshly cooked potatoes with that lovely sculptured butter on the table and fresh mashlanka. There was no better life than that for a youngster like myself. And then after the food and the social entertaining would come bedtime, and I would get tucked in to these freshly starched sheets, and I would snooze off into deep sleep, not a worry on my mind. I would sleep so well until awakened by the sound of one of these creatures, or the clanging of the well bucket as it would go down into the well to draw the water for house purposes and for our use in the morning. As I would enjoy this experience of visiting with the family and visiting this home, playing there, spending my holidays, never as a child would I think of a time that came before that experience or the time that would come a little post. Never would I think of a time when these loved ones would be no longer. I now have 6 grandchildren of my own, and I watch them play carelessly without giving any thought to the past, without giving any thought to the future. But it was in the summer of 1963 that we got our passport photographs taken, and we left Poland for a place that was only known to me as Australia. And there, after boarding a train in Poland and travelling all the way to Italy, to Genoa, we sailed by boat across the Mediterranean, through the Suez Canal, and ultimately across the Indian Ocean to this new country of Australia that some people regarded as a land flowing with milk and honey, but most people found it to be a very, very challenging place, a new frontier. But what was interesting, it was during those 5 weeks of travel, particularly as we crossed the Indian Ocean, it so happened that it was during the time of the great standoff between the US and the USSR over the Cuban nuclear missile transportation. And as a child who had never experienced this vast expanse of water except for playing on the banks of the Wisła River, I remember sensing the fear that came from the discussion between some of the adults as we were crossing the Indian Ocean, and the world seemed to be on the brink of war. But I was at that point in the safe arms of my mother, who, in her own very gentle way, would hum a very beautiful Polish spiritual. It was such a wonderful spiritual that till this day I remember the melody. And I made it a point to look up the words to that Polish spiritual. And I hope that these words will never be forgotten in my life, because they provide a lot of meaning for me today as I pursue my goals and my commitments. The sound of her voice I can still hear very clearly. And even on occasions when she would sense a slight quiver in her voice, I would look up to see tears in her eyes. I know that this is a melody and these are words that I must always retain in my own mind. And I would hope that as you pursue your studies, that you will never lose faith in the purpose and the calling that you have sensed in coming to medical school and studying and preparing yourself for a life of service. But today, as I visit the old home, unoccupied home, just on the outskirts of Wynsuit, I oftentimes reflect on the directions of life. In looking back, I see things a lot more clearly. Only now can I link places, events, choices, and consequences, and I realize that you can't connect dots looking forward. You can only connect them when you look backwards. So you must trust your sense of calling. You must proceed forward in faith, because oftentimes the things that don't make sense now will make sense in the future. As I was riding that steam train to Wynsuit from Krakow, I never anticipated today's opportunity, and that is why faith is so important. And if you should choose to plan out and map out your future, but always do it in pencil. And as I stand by the water well and memories are recreated, I remember the strong arms that held me there, and he taught me some of the most important lessons in life. It's there that my mother, who passed away some 18 years ago, learned how to grow beautiful peonies. And the art of growing peonies was something that was passed from her to her by her mother and also by her grandmother. It's still an art that I want to master in my own life as I try to grow peonies in Australia. And I hope that one day I might be able to pass this art on to my own grandchildren. But there are still lessons in my own life that I want to learn, and among these lessons is the lesson that we must learn to grow and blossom where we are planted. And that after all is said and done, I'm always mindful that much of what happens in our lives, no matter how small or how great, our successes and our achievements are often less by effort and more by grace. The older become, I listen to the hammering of the clock, the tick-tock of our lives, that reminds me of our life's brevity. And I still need time to stop, to review my life, to review where I'm going by searching for clues of where I have been, to search for hints as to who I am becoming or failing to become by reviewing what used to be. So today, as we reflect on the anatomy of success, I want to emphasize for you again, remember the keys to success: faith, hope, and love. And be sure to pursue your calling no matter what the cost, no matter what obstacles might come in your life. And to that end, I wish you every success in your academic pursuits and also in your personal life. And I thank you for the kind invitation to share this moment with you.
Thank you very much. I hope that this piece of advice for all of us were really very important. Your lecture was full of passion, and I'm sure that all of us will still remember about your advices. Thank you very much once more.